Hello everyone, today we'll be studying about the necrotizing sialometaplasia, inflammatory and the reactive condition of the salivary gland. Okay, so let's begin. Necrotizing sialometaplasia is a benign, self-limiting, reactive, inflammatory disorder most frequently affecting the minor salivary gland and rarely the major salivary glands and the mucoserous gland of the upper respiratory tract. Epidemiology. It commonly affects from 17 to 80 years of the age, has the male predominance, and the most common site is the palate, retromolar pad, gingiva, labial mucosa, tongue, and the buccal mucosa. The development of the NS has been associated with the mnemonics sit pedial, sit BAF or whatever you can say, sit pedial, okay, as smoking, local injury, blunt force trauma, D for denture wearing, dental and the surgical procedure, administration of the local anesthesia. Similarly, it has been reported in the pregnant patients and those with the diabetes mellitus, sickle cell diseases, history of the cocaine or the alcohol abuse, anorexia, bulimia and the chronic vomiting. Clinical manifestation. Most often the NS presents as a painful, rapidly progressing swelling of the hard palate with the central ulceration and the peripheral erythema. The associated pain is often described as the SARP. The numbness or the anesthesia is associated in the associated area may be an early finding. The lesions typically are rapid on onset and ranges in size from 1 to 3 centimeters. Although I already discussed about the common site, it can also be affected in the sites like the tonsils, in the nasal cavity, trachea, maxillary sinus, and rarely in the parotid gland. Although the lesions are usually unilateral, the bilateral cases has been reported. The lesions often develop shortly after the trauma. Now, differential diagnosis. The NS of the hard palate clinically resembles the salivary gland malignancy, particularly the mucoepidermoid carcinoma, adenoid cystic carcinoma, although the rapid onset of the NS has the distinguishing feature. Now, let's talk about the management. NS is usually a self-limiting condition, resolving within 3 to 12 weeks. During this time, the supportive and the symptomatic treatment is usually adequate. The appropriate analgesics combined with the antiseptic mouthwashes such as 0.12% chlorhexidine gluconate is recommended. The surgical intervention is typically not required. However, there is the report of resolution following the debridement of particularly large lesions and those secondarily infected with the bacterial sepsis and the candida. So that's all.